Once again in Diamond Diagnostic Center, we solve all your health problems such as prostate problems, infertility, you've been married for so long and no fruit of the womb, low sperm count, stomach ulcer, fibroid, liver and kidney problems. If you have all these problems and more, do make a date with Dr. Marina on Health Solution for deep medical science facts and home remedy.
We are continue our cycle of the programs when we explain and just give you advice how can be managed and how can be cured different diseases which is usually is not detected. Today we are planning to discuss about the stomach ulcer. How the people detect and why it is not curable long period of time, and why they are telling all the time like I have a stomach ulcer during 3 years, 5 years, 7 years, 10 years, 13 years. I don't even know how it is possible to have this long period of time stomach ulcer if the stomach ulcer at our facility can be cured during 7 days. I'm so surprised, and today together with the Dr. Joshua Asante we will just find the solution and we will understand what is going on and what is happening, why the people just give these testimonies that during 13 years they couldn't treat stomach ulcer. If it is just short period and you cure and you are healthy and you forget about all the problems. Now, how we just discuss and detect that a lot of people just complain about the stomach ulcer. To detect the stomach ulcer, we can ask Joshua Asante what is necessary to do to detect it.
Apart from the patient giving symptoms to the doctor that the doctor might think, first you have to go to a good facility with a very experienced doctor, like our facility, that you do some laboratory testing, you do scan, and if possible, you can refer the patient for endoscopy. That is on the last stage or another aspect. But first, you need to do laboratory testing and then the scan.
Which type of the lab is necessary to do?
When the patient is coming, you see, you can give requests for the full blood count.
Okay. To see like presence of pathological bacteria and inflammatory process.
Yes.
Okay.
You can do urine test.
Urine?
Urine test is
yes, I know that urine test is just a microscopy.
Yes.
It shows a lot of points that cast cells, ciliatic cells, and different type of the cells, which is just, I want to take your attention, that the cells which is from digestive system through the kidney enter into the urine and indicate that you have problem with the pancreas, you have problem with the gallbladder, you have problem with the stomach and duodenum, can be detected inside in the urine.
Yes.
And what is the name of that cells which is supposed to be inside?
You see pus cells, a lot of pus cells. These are from leukocytes. That's white blood cells, which will give an indication of an infection. You see, what benefit patients will get when they come to our facility is detecting the root cause of the ulcer.
The cause of the ulcer.
Root cause.
Okay.
Another laboratory test that can be done is liver function test.
Okay.
You see, the liver has a greater connection to the digestive system, and that if the liver is not functioning well, the patient can get ulcer. And then from the scan, we can also detect pancreatitis, that the pancreas is also playing a major role in the digestive system to neutralize acid.
Okay, now, how you explain about that necessary to do full blood count, urine test, liver function test, and lipid profile to detect how the function of the digestive system. Let's look and see. Our digestive system is coming from the esophagus, then it is coming stomach itself, like a sac, then it is coming small colon, small intestine, short part called duodenum, and inside to the duodenum from liver and from the pancreas, producing juices to neutralize the stomach acid. If the gallbladder is not functioning well, bile is not entering, and the gastric juice is not neutralized.
Yes.
If the pancreas is tight to work or
Yes.
working so hardly,
Yes.
like the people has diabetes, that pancreatic juice
Yes, it's
is
not
not coming enough and doesn't neutralize hydrochloric acid, and the same like acid is stay there. What is the symptoms of these points if the people has that acid is not neutralized so well?
One major symptom, they call it the heartburn. After the short eating, the smallest food that they take, they have this complaint of
Like epigastric pain,
Yes.
then it is coming belching,
Yes.
then it is coming like reflux disease,
Yes.
reflux symptoms,
Yes, yes.
and later they qualify like a disease. Like gas is coming and you make like hiccup and another. Plus additionally that
It can cause palpitation.
heart palpitation.
Yes, heart palpitation.
This is maybe because of the esophagus
Goes
is coming
closer to the heart.
to the back side of the heart,
Yes.
and when the hyperacid coming up, it is giving burning sensation, and the people start to have panic that they wake up and they think that now
Something bad is
they
happening.
couldn't breathe, the heart is beating fast, and they are just where they are rushing. They are rushing to the cardio department to check the heart. A part of my advice to the people, before it is happening and you think that your heart is spoiled and something happened to your heart, you're supposed to go to our facility to detect and start from the simple things.
Yes.
Because all the diseases, like in my vision, that it is coming or through the mouth or through urine tract. Because only two entrance for the bacteria or to some of the problems which can come.
Yes.
And how I understand that our tropical food, it is contain everything.
A lot of acid,
It is like oily food,
which is fatty acids.
fatty acid.
Yes.
What about fried food?
Fried foods also contain these oils.
Fatty
Fatty
acid.
acids coming in.
If we are eating a lot of meat,
A lot of meat.
to digest it, the same necessary to have a lot
a
of
lot of
hydrochloric
chloric
acid.
Yes.
Then we are taking like nuts, peanut, granite, red oil, and another.
And a lot of hard food, like the plantain, very hard.
No, it is a lot of starch there. Because of it, it just make everything like a plaster.
And giving pressure to the stomach, the pancreas.
Of
and
course,
the
it is
whole-
not easy to digest.
Yes.
It means the people who have that symptom, they're supposed to go for the light food.
Yes, very soft soup. And then
Everything,
food that
everything what
should
you
be
are
soft.
cooking, it's supposed to be like baby food.
Yes.
Very, very light, very, very, very small, like the people can even soak it. If you take piece of meat, you add a little bit vegetables, mash it, add a little bit rice or something that you need all the food supposed to be very light and easy digest.
This correct diet we are providing at our center.
This is okay. It
This
means you
correct
need to
diet-
come and visit our
Yes,
facility.
we will teach you the
How
kind
need to
of
cook.
food you're supposed to eat
Okay.
and how you need to prepare the food, not to contain too much salt and these acids.
So Rakwe is my name, and then for the past 3 years now, I've been having issues with my tummy. I've been to a lot of health centers and I don't see any improvement. My friend recommended Dr. Marina to me and I tried passing by. In less than a month, I've seen a lot of improvement. Guys, anybody with health issues should pass by Diamond Hospital. Diamond Hospital should be your last stop.
You can contact us in Accra on 0202 112 866, 0243 176 119. In Kumasi, call us on 0267 018 289, 0207 515 623. In Takrady, call us on 0558 294 804, 0548 705 543. And in Tamale, opposite Kamina Barracks, behind Second Star Oil Filling Station on the Bolga Road. You can call us on 0500 022 853, 0558 294 091. Diamond Diagnostic Center, your last stop in medical services.
Let's look and see our digestive system. Everybody telling about the stomach ulcer. And in the same time, before the stomach ulcer create and develop, everybody is just trying to be on the special diet. They are drinking water in the morning and add a lot of lime, lemon, citric and cider vinegar, different type of the acid.
Yes.
And the people don't understand that physiologically we have inside in our stomach, we have a muscles, and inside we have a mucus, which is protecting the muscles against that hydrochloric acid. And when we have hydrochloric acid, which is very strong acid, and we add additionally lemon acid, citric acid, vinegars and another, and it just start dissolving the mucus and start create the ulcer itself.
Yes.
And that ulceration coming not only inside the stomach, it is going to the duodenum, it is going inside to the colons, and we start create another additional diseases, which is called ulcerative colitis.
Yes.
And this is another one. Doctor, but everybody now, even the people who doesn't have medical education, they are going to check their H. pylori.
Yes. They are going to check H. pylori because they've read a lot of books from literature that they are saying the major cause of ulcer comes from the H. pylori. But
Not acid.
Not acid. So, from research, when they read, that is what they find. But you need someone who is experienced to be able to link that ulcer can be as a result of infections,
Okay.
hyperacidity,
Okay.
dysfunction of your liver,
Okay.
dysfunction of your pancreas.
Oh, it is the 5 organs you mentioned.
Yes.
And that 5 organs,
Aspects you need to check everything.
but the treatment for all of them are different.
They are different. This is
But
why in our center
This
we
is
are
why they're
hearing
saying that they couldn't treat the disease during 13 years.
Yes, because they are thinking of H. pylori and pushing antibiotics. And antibiotics,
And receive another disease.
good. Antibiotics also causes hyperacidity
Of
from
course,
research.
of course.
So if they think that ulcer is as a result of H. pylori and they are giving antibiotics, meanwhile, the person's ulcer can be from the diet. You need to give the correct diet. Can be from dysfunction of the liver. So if you don't treat the liver, the ulcer is not resolved.
It will be stay there.
You understand my point? This is the reason why our center looks at all these aspects and we are able to tackle and give effective treatment. We investigate to know the cause. Is it infection? If it is infection, we have products that we will give. Is it a liver condition that the bile or the gallbladder?
Doctor, is it so difficult to stay on your diet?
It is not.
Because the people always complain that it is so difficult. If they are coming to the facility, it is not possible, that we are just put them on some of the diet. Is it so long time they're supposed to be on the diet?
To get ulcer is simple.
Or to get ulcer, it is, of course it is
It
simple.
is dangerous.
Just drink this antibiotic, or drink this lime water, or drink some of the vinegar water.
Yes, and you
it
have
is-
ulcer, and ulcer can be dangerous because when the sores are coming, you start to lose blood, and this can cause weakness, and then your hemoglobin level can be low.
and you feel dizzy.
You feel dizzy,
You
and it
couldn't
can
go
kill
to
you.
work.
Heart palpitation, even sometimes giving you from epigastric pain to the back pain. You see the dangers of ulcer. And then we're giving you diet to follow, like 1 month, 2 months,
Just
3
that's all.
months to repair.
You
The
see that
stomach,
just
it
a
is
short
not
time,
difficult.
1 to 3 months, and you just your ulcer is dissolved, and everything is going to normal condition. You can eat again pepper,
And whatever
oily
you want
food,
to eat.
fried food. You can eat everything because you are healthy.
Yes.
Till that time, when you develop and create new points.
The most important thing I want to add is for any effective treatment, it is very important to know the root cause, as we have mentioned. From the beginning people were complaining. We made mention that they've been to other facilities like 13 months,
13
more
years.
than 13 years, they don't have cure for ulcer. They come to us and within 7 days, maximally 1 month, they have cure. This is because we have special devices and machines and experienced doctors who are able to diagnose and find out the cause of that condition. Like we mentioned, everybody is thinking about H. pylori as the cause of ulcer. But we've mentioned today other aspects that causes ulcer and the symptoms and effects that this ulcer will give. Now then we come to the treatment in our facility. What special medicines and products do we have to treat
No,
ulcer?
about the special medicine, we just use a local, very popular moringa tree.
Good.
We are preparing special drink,
Okay.
which is called Moringa Plus.
Very good.
And that Moringa Plus, it is just cover the stomach,
Okay.
protect from hyperacidity,
Okay.
boosting immunity,
Okay.
stabilize the pH and well-being,
Okay.
and just people supposed to follow additionally the diet.
Very
How
good.
we tell? Need to cancel off everything which is called acid.
Very
This
good.
is a fried food, oily food, acid, citric fruits, pineapple, which
Yes.
is called the same acidity. Then it is like
Heavy food.
heavy
hard
food. Heavy food like
Plantain.
plantain, then it is fufu.
Fufu.
Then
bamboo.
it is, no, I want to mention that hard one, it is like a steamed rice, which doesn't have water, doesn't have a
Fried
soup.
rice.
Fried rice, jollof rice, which is heavy. The meat, which is inside, very hard. We're supposed to, if we are cooking that meat, to put meat, boil it very well, that it stays soft, and need to cut on the small pieces, and take with the boiled vegetables and just mash even the vegetables. That everything what you take, it will be easier absorb and easy digest.
Yes.
This is during first week.
Yes.
Then the people can gradually to add. If they are taking the eggs, the yolk must be soft.
Yes.
To make soft yolk, it's just 3 minutes, boil it, and soft yolk, it is just cleaning even the cholesterol
And reducing acidity too.
and reducing acidity.
Yes.
You see like how many news we know today about that food which is previously told that it is very dangerous and we shouldn't eat.
And
We can eat a lot of things.
Yes, and to add, we mentioned the aspects of the causes of ulcer. Do we also have special medicines for the liver and pancreas?
Yes, we have a medicine for the pancreas, we have a medicine just regenerate the pancreatic cells. Because if we don't treat the acute pancreatitis, like it means inflammation on the pancreas, when it is not producing enough juice, finally pancreas tied to work and it is caused and create the diabetes.
Oh,
Like
okay.
everybody knows now,
Okay.
like Argentina scientific research,
Okay.
they just show last year
Okay.
that diabetes type 2, it is a result of the acute pancreatitis.
Okay.
And now everybody understands that if you want to prevent diabetes, you need
to take care of the pancreas.
you need to take care of the pancreas, need to take care of the diet, and we have a special solution for it. Because of it, doctor, we will invite everybody who just has the problems that necessary to come and visit our facility.
It is very important that we can be able to detect it early and know the cause, give you advice that is on the diet, and give you medications, not chemicals that will cause another disease. You can come to our center both in Ghana and Nigeria. In Ghana, we are in Accra, East Legon, opposite the Legon University Sports Stadium. In Kumasi, we are at TUC Junction near Santase Roundabout. In Takrade, you can locate us at Anaji, opposite St. Peter's International School. And in Tamale, you will see us behind Kamina Barracks, opposite Star Oil Filling Station. In Nigeria, you will see us in Lagos, Victoria Islands.
32A at the Tecumba at the Mola State.
Yes, you can also go to the internet, www.dimedghana.com. YouTube, we have the Dimed TV. You can also call the numbers that are shown on the screen for further questions. Welcome to Diamond.
Stay with us.
And then you come with the a brew fire home with them. A fire, a hinter with any pedemu, a chassis a young, not a fee, a bed than a recessia. And then you didn't come more after stomach ulcer. And Pimpino, Nipa and pain said stomach ulcer. Yare, at now almost watching. It be the Anantia or somebody free me more fast and you catch and say, me ulcer. A call in fear, a 2 years, 13 years. And the engineer bedroom in Pempen, so leave you so in Yaya. Or one or more was how you two and a more a buyer so ye. Now watch it, a child or something, now Omania Ayarisa. And then the money bassa, the money bassa, you know, say, and what say, a dear a this house stomach or sane, a ban, you. Say your head, your Hunama, your friend of digestive system now. You free a minimum, dear friend of esophagus. A bessie, your stomach, I had to say sack. And now your warrior show in Kituano to us, any acasium. And now your warrior bread bore, I know so a war linkage you call your show in Kituanim, and the pancreas, and also a coil show in Kituanim. Nina sees your who's you. At the back, your digestive system, murder near it, it may not come. Now, your liver, any your pancreas, your war in soupy, and war your stomach, a friend of hydrochloric acid. Now, Yame SEC, your stomach cannot say, a war was, and as a mucous region, a poor stomach and a by Emma, Emma, a free, sa hydrochloric acid. Enti enuane free your stomach no say be koye nso nketu animu a na e wo se saa acid ni dwumadie nyina no e free ho e no na liver ye brebo no e de pancreas ne boa e beye enti se wo ye obi a wo temache e wo liver anasa wo pancreas na dwumadie ni nsisi so yie pe wutimi nya ulcer e na afi nso obi a wonya hyper acidity titu eni nuane ye yedi je no manka oranges, pineapple, and a ding a bema ye stomach and as a digestive system, no be bread and sana, etimiana near Biane, Tissil fufu, a ding, making fufu, and I said, body and precia so a ding in ano, etimid the sour or however. It won't say a church in more who say, call I am Sabianes when your stomach was a near my baby. So call hospital and I say, Uquire Sabia near you, Muafa, stomach ulcer, your mouth call up. Ubaka, your full black count near human who dear caution, your mouth urine test, say infections in the man, sa or sanebaya, near your liver function test, and now lipid profile, Nina Bois, Timima Ucha scan so. Now, Ubaya Suya, yes, I am Muna, yet me who say, Usoma ulcer when yam. Infections and the diapa. What dear when you bread born on the dwumadie nsisi ye and answer pancreas no na nedie no nsisi ye and answer nnuane a wudi na ma acid a wo nipa wie no ma ye dey adoso emuti na mo wanya sa stomach ulcer na se ye hu ne fiber ni wi a afa ni aba ni treatment yesiesie aduro sonko a ye nya no wo Africa ya eye moringa and ye di aye drink ya ubenom eye moringa plus enura hodo ka ho aye de ma wa e kokova anase e kata stomach no ekuro na e wo ho nyina na ye de nuro ahodo aka ho e bema ekuro na wu titiru ni ye tufo e wo nnuane diet a wo bidi so be bosome anase bosome miensa na asiesie yafunu nyina kama eyikuro ni nyina ye de efiri ho enti ye to ye safro say to anamo ne brantem if it's a stomach ulcer e wonsun so boni bebre enti bra ya so ye na behia Dr. Marina ene na doctor fo na yenye woni pedua no nhwemu enhu ulcer na wanya no de e ma ne baaye na afa ye wo natural product a ye de be ma wo a e be yi sa wo ha ni nyina ye de efiri ho no Oba Yashia Yewon Kraya, Yewo East Legon, Yeni Legon University Sports Stadium in the Kumasi Yewo TUC Junction, Ben Santasa Runabout, Tamale Yewo behind Kamina Barracks, a year opposite Star Oil Filling Station, and Atakra Den so Yewo Anaji, opposite St. Peter's International School. Your numbers was screen you saw, O Freya, O Chenchemubia, O Pibia, the Bemau, Nigeria, so Ubehu Lagos. Victoria Islands. Fawaria would the Anantia Winyan would say a liver muhau, a ye kidney muhau, a ye a womb muhau, a ye prostate, where Chika say, and you see Bema or Hoarding Wumpum, Ewo Fomwa, Fabra, Nayan 2 Yariana, as a mouth cry. Ubeko internet and Subehuye, www.diamedghana.com, and YouTube also Diamond TV.